Our case study explores Mr. Willow, who was recently diagnosed with bacterial pneumonia 1 week ago. It appears that Mr. Willow was not following his medication regimen once his symptoms were relieved. Additionally, Mr. Willow had complaints regarding the side effects of medication, which includes diarrhea. Our group considered these issues concerning following medication adherence to the prescribed regimen. Since non-adherence has significant impacts on patient health, our teaching plan prioritized a deeper insight into the importance of medication adherence. The teaching plan will enable the patient to recognize the importance of following the prescribed medication, become well-adjusted, and expect to have the desired health outcome. Hi, my name is Jamie and I will be your student nurse. How are you feeling today?
Hi, nice to meet you. Fantastic, never been better.
I'm glad to hear that you are feeling better and that you're back to your old self.
Yeah, now that I finally stopped taking those antibiotics.
Your medication records show that you were prescribed a course of oral antibiotics for a bacterial pneumonia to be taken for 10 days. Is this correct?
Yeah, they gave me horrible diarrhea. Plus with my job, I'm too busy to take them on a regular basis. Plus I feel great anyways.
I understand it must be difficult to take these medications on a daily basis. Can you please tell me when you stopped taking them?
2 or 3 days ago, I think.
Okay, I can see that is 5 days after the prescription was made. Is that correct?
Yeah, right around then would be right.
I can see you are a busy man, Mr. Willow, and having diarrhea must have been difficult to continue on with your daily activities.
Exactly. Why would I want to try and fit these meds in if I feel fine now? Plus they give me awful diarrhea. If I feel great, the infection must be gone anyways.
If it's all right, I have a few more questions. Can you please tell me the 2 antibiotics you were prescribed by your doctor?
Amoxicillin and erythromycin.
Can you tell me what the purpose of these medications are in relation to your current condition?
Both meds were for my infection. They said something about combining both would be best.
Thank you for explaining. I can see that you know what these medications are for and the reason why they are ordered. I would like to add in some related information that further explains the importance of completing the course of your medications. Would it be okay if I continue?
Sure thing.
Great. As you mentioned, the oral antibiotics you were prescribed are to help kill the bacteria causing inflammation in your lungs. Completing these antibiotics are important to prevent antibiotic resistance.
What's antibiotic resistance?
Antibiotic resistance happens when bacteria develop the ability to defeat the drugs designed to kill them. The bacteria that are resistant begin to dominate the body. So if an infection reoccurs and begins to cause inflammation, the same antibiotics used previously will not be effective in killing off the bacteria.
Oh, that does not sound good. But what about the diarrhea?
The diarrhea you experienced was a result of the antibiotics killing off all the bacteria. This includes the good bacteria that helps break down the food in your stomach.
Oh, okay. Well, what can I do now?
The best recommendation I can give you is that you should always try your best to finish all your medications for the prescribed duration. That way, you can reduce the chances of developing antibiotic-resistant bacteria.
Okay, that makes a lot of sense now that you laid it all out there for me.
I know I've just provided you with a lot of information and I understand this can be overwhelming. I was just wondering if you could explain to me in your own words what you understand by the information I just shared with you.
In order to avoid antibiotic-resistant bacteria, I need to complete my full course of antibiotics, even though some side effects are not the greatest, like diarrhea. If I don't complete the full course, I run the risk of another infection that can't be treated using the same antibiotics.
In the future, if you experience diarrhea as a side effect of a medication, it is important to keep adequate nutrition and hydration to avoid dehydration. Foods such as boiled starches like potatoes and cereals are good to eat. Also, avoiding foods with high fat content and dairy products while you have diarrhea can help.
Thank you, that is good to know.
How do you feel about today's session?
I feel like I know a lot more now, so thank you for helping me understand why it's so important to finish my antibiotics.
Do you have any questions for me to clarify or a concern you would like to bring up?
Yes, I do actually. Since I have such a busy schedule, is there any way taking these can be more convenient? Carrying these bottles around just isn't working anymore. I keep leaving them at home or in my jacket pockets.
There is an option of using a blister pack in the future. If you have to take medication and you have a busy schedule, the pharmacy can pack your medications according to their scheduled times to make it easier for you to cut out and take with you wherever you are going without worrying about forgetting the bottles anywhere.
Oh, that sounds helpful.
Here, I'm going to give you a pamphlet with the website listed that has more information regarding antibiotic resistance if you'd like to expand your understanding or would like a reference.
Oh, perfect. Thanks, I'll definitely look into this.
Do you have access to a phone with internet connection or a computer to reach this link?
Yeah, I have a cell phone with internet.
That is good to hear. If you don't have any more questions for me, what was your takeaway from our session today?
Completing a full course of antibiotics is important to avoid antibiotic resistance. Thank you for taking the time to explain everything to me. It was really helpful, and now I understand why I should finish my antibiotics even if I feel fine.